Dr. Frings, you just opened your own ophthalmic practice a few months ago. Why did you choose the MR6000 for your ophthalmic practice?
Thank you very much. Very interesting question. Basically, I chosen this device as it is a all-in-all solution. So we can measure practically every patient that gets into the office.
Which challenges in terms of visual complaints are you facing, and how can the MR6000 support you in their diagnosis and treatment?
Actually, we measure every patient with the MR6000. So we can do the refraction measurements, we can do the K readings, we can do the pachymetry, we can do the non-contact IOP measurements, and I especially like the dry eye unit that we can get with this device.
And which function of the MR6000 do you most often use in your daily workflow?
Well, good question. Most often, well, I would say we apply the K readings and the refraction measurements in any patient that gets into my office. And well, the second most thing we do are actually the non-contact measurements for the IOP and the pachymetry as well.
And in the MR6000 you have the possibility to measure tonometry and pachymetry as single examinations and also in combination. Why is it important to take the result of the pachymetry into account to correct the IOP value?
Yeah, very important question, and that's what I appreciate about the device. So we can do one measurement and get the results of both the pachymetry and the non-contact IOP. So as most of you will know, of course we have to get into account the pachymetry when we apply non-contact measurements for the IOP or do any other IOP measurements, as the pachymetry influences, of course, the readings we get. So thin pachymetry will result in a little bit more higher IOP than we actually get when we wouldn't know about the pachymetry.
Thank you. And as you already mentioned, the MR6000 does have a dry eye observation function. Dr. Frings, you are an expert in the field of dry eye. Which are the typical symptoms of a dry eye?
Thank you. I wouldn't say I'm an expert, I'm just doing my job, but I appreciate it. Well, typical symptoms are quite a lot. So basically I see a lot of patients that have been treated for something like a dry eye disease in the past, but they don't have a real dry eye. Dry eye is a real diagnosis, and we here in Germany, we have about 12 million people that have, so to speak, dry eye, but only a few of them have a really dry eye. So what I appreciate about your device is that we can do a lot of measurements in one device with only in a few seconds. So we get the lipid layer information, we get the meibomian gland analysis, etc., only in a few seconds. And that's quite helpful for me to get to the real diagnosis.
So as you mentioned, the MR6000 does have several measurements which altogether give the result for the dry eye. So it measures the blinking frequency, the hyperemia, the tear meniscocyte, and also the meibomian glands. The analyzing of the measurement results is still in the responsibility of the doctor. Do you have tips and hints what to take care for and how to interpret these results?
Yes, thank you for that very important question. So the first thing you have to think about is don't make up your diagnosis with only one measurement. Repeat your measurements and don't rely just on one information. So all the devices, they have one problem. They only measure the thing you need to get, the parameter, with their special technique. It's always important to have more information to establish your diagnosis. And that's still the responsibility of the doctor or somebody that puts the puzzle together. And that's quite important.
Thank you very much.
You're very welcome.